All right, my friend, let's have an honest talk. If you're a woman over 50, you've probably noticed your body doesn't always feel the way it used to, and that can be confusing, sometimes even scary. Maybe you get hot flashes that come out of nowhere. Maybe you wake up in the middle of the night soaked in sweat, or maybe you walk into a room and think, what did I come in here for? Then you might ask yourself, is this just aging? Am I losing my memory? Let me reassure you right now, you're not alone and you're not losing your mind. More than 1 billion women worldwide are either going through menopause right now or will be very soon. That's about 1 out of every 7 people on Earth. Here's something that really surprised me. A recent study found that over 80% of women with menopause symptoms never talk to a doctor about it. Think about that. 8 out of 10 women are dealing with these changes quietly. Some are too busy, some don't know help exists, and many believe this is just something they have to put up with. But here's the truth, you don't have to suffer. Today, there are safe and effective treatments that can seriously improve how you feel. The first step is understanding what your body is going through. So today, I'm going to share 14 common signs of menopause every woman over 50 should recognize. You'll probably recognize a few, but I promise you, some may surprise you. In fact, sign number 3 is so rarely talked about that most women never connect it to menopause. Quick reminder before we start. I'm not a doctor, and this video is for education only. I'm not diagnosing anything. If these symptoms are affecting your daily life, please talk to a healthcare professional. One symptom alone doesn't mean menopause, but it's a reason to get checked. All right, let's get started. Sign 14. Hot flashes that come out of nowhere. This one's probably the most well-known sign of menopause. And if you've had it, you already know exactly what I mean. One minute, you feel totally fine, and the next, it's like someone flipped on a heater inside your body. Your face gets red, you start sweating, your heart might start racing a little. And the worst part? It shows up without warning. In the middle of a meeting, at church, out to dinner with friends, or right in the middle of the night. About 8 out of 10 women experience hot flashes during menopause. So what's really going on here? As estrogen levels drop, the part of your brain that controls body temperature gets extra sensitive. Think of it like a thermostat that's gone out of whack. Even a small change in temperature makes your body think it's overheating, so it reacts fast. Blood vessels open up, you start sweating, and that intense wave of heat hits you all at once. The good news? Help is coming. Recent research looked at a newer medication called fezilantant, designed specifically to calm the brain signals that cause severe hot flashes, and the results show that real relief is possible. What makes hot flashes especially tough is how unpredictable they are. Some women get them once in a while. Others get several strong episodes every single day, sometimes for years. If this sounds like you, start keeping track. Write down when they happen, how strong they feel, and what you were doing right before. That information can really help your doctor find the right treatment. Sign 13. Night sweats that soak your sleep. Waking up in the middle of the night completely drenched in sweat, even when the room is cool, can be scary. And no, it's not just your blankets. For many women, night sweats are another sign of the hormonal chaos happening inside the body during menopause. As estrogen drops, your internal temperature control system gets confused. Your body thinks you're overheating when you're not, so it reacts by opening blood vessels and making you sweat heavily, sometimes soaking through your pajamas and sheets. Research has shown a clear connection between severe night sweats and lower estrogen levels. And this isn't just uncomfortable, it affects your health. When night sweats keep waking you up, your body doesn't get the deep sleep it needs. Over time, this can lead to constant daytime tiredness, trouble focusing, mood changes, even memory problems. Many women miss this as a menopause sign because they blame the thermostat, the mattress, or the weather. But if waking up soaked in sweat is new for you, pay attention. Write down how often it happens and how badly it disrupts your sleep, and bring that information to your doctor. Sign 12. Mood swings that feel out of control. Feeling unusually irritable, emotional, or on edge for no clear reason can be one of the most frustrating parts of menopause. And no, it's not just stress or you being difficult. As estrogen levels drop, it affects key brain chemicals like serotonin and dopamine, the ones that help regulate mood and emotions. When those chemicals fluctuate, your emotions can feel all over the place. Happy one minute, anxious the next, tearful or upset without knowing why. Studies show that about half of all women experience noticeable mood swings during menopause. That's because estrogen receptors are found in parts of the brain that control mood. When estrogen drops, those areas become more reactive. You might snap at your husband or grandkids over something small, cry during a TV commercial, feel anxious about things that never bothered you before. Then you feel guilty and think, this isn't me. But here's the truth. It is you going through a major hormonal change. Don't brush these feelings off. If mood changes are affecting your relationships or daily life, start noting patterns and talk to a healthcare provider. You deserve support through this. Memory slips that mess with daily life. Walking into a room and forgetting why you're there. Forgetting something you just heard. Losing your train of thought halfway through a sentence. Or suddenly blanking on your neighbor's name even though you've known her for 20 years. If you've always had a good memory, this can be downright scary. A lot of women immediately think, is this dementia? Is this Alzheimer's? Here's the reassuring truth. Memory problems during menopause are real, very common, and usually temporary. Research has shown that during the menopause transition, many women experience slower thinking and trouble with verbal memory, especially remembering words in conversations. Why does this happen? Estrogen plays an important role in the hippocampus, the part of the brain that helps form new memories. When estrogen drops, that area doesn't work quite as smoothly. Add poor sleep and mood changes into the mix, and you've got the perfect recipe for forgetfulness. What makes this symptom especially upsetting is how it hits your confidence. You may feel embarrassed, less capable, or worried about work or daily responsibilities. But here's the good news. For most women, these memory issues improve after menopause. If you're noticing changes that really concern you, write down specific examples and talk to your doctor. It's also important to rule out other possible causes, like thyroid issues or vitamin deficiencies. Sign number 9, low sex drive that affects intimacy. This is something many women feel uncomfortable talking about, but it's incredibly common. If you've noticed your interest in sex isn't what it used to be, you're far from alone. In fact, more than 3 out of 4 postmenopausal women report a lower sex drive. And no, it's not all in your head. As hormone levels drop, especially estrogen, physical changes can make intimacy less comfortable. Vaginal dryness and discomfort can take the enjoyment out of sex. At the same time, testosterone, which also affects women's libido, declines with age. On top of that, other menopause symptoms pile on. Poor sleep leaves you exhausted, mood swings and anxiety kill desire, weight changes can affect confidence. The good news? There are solutions. A recent study showed that therapies like cognitive behavioral therapy helped women improve desire, arousal, and overall satisfaction. If low libido is affecting your relationship or your happiness, don't suffer in silence. Talking openly with a healthcare provider can lead to real practical help. Sign number 8, constant fatigue that doesn't fix. This isn't normal tiredness that goes away after a good night's sleep. This is the kind of exhaustion that sticks with you all day. You wake up tired, you stay tired, and rest doesn't seem to help. During perimenopause and menopause, estrogen and progesterone levels drop. These hormones help regulate energy in your body. When they fluctuate, fatigue becomes very common. Here's something especially important. Research has found that women with heavy or prolonged periods during perimenopause are much more likely to experience extreme fatigue. Heavy bleeding can lead to iron deficiency, which makes exhaustion even worse. Fatigue during menopause usually comes from several things at once. Hormonal changes affecting energy production, sleep disruption preventing real rest, mood changes draining mental energy. Because fatigue has so many possible causes, many women brush it off as stress or aging. But if you're constantly exhausted despite resting, especially if it's happening alongside other menopause symptoms, it's time to get checked. Sign 8. Thinning hair that changes how you look. Noticing your hair getting thinner can be really upsetting. Maybe you're seeing more hair in your brush. Maybe your part looks wider than it used to. Or maybe you're starting to see more of your scalp, and that never used to happen. This is very common during menopause, and it's mostly tied to dropping estrogen levels. Estrogen helps keep hair growing strong and healthy. When it declines, hair follicles can shrink, which leads to finer strands and more shedding. Studies show that over half of postmenopausal women experience noticeable hair thinning or hair loss. Hormones aren't the only factor, though. Genetics, stress, and diet all play a role. Low levels of iron, protein, or biotin can make thinning even worse. Because hair is such a visible part of how we see ourselves, this symptom can really affect confidence. If you're noticing significant thinning, talk to a healthcare provider. There are options that may help, like hormone therapy, nutritional support, or topical treatments such as minoxidil. Sign number 7. Ongoing dry skin that just won't go away. Dry, itchy skin can be more than just annoying. It can actually be a sign of menopause. Estrogen helps your skin stay hydrated by supporting your body's natural moisture system. When estrogen drops, your skin loses moisture more easily. That's why it can start to feel dry, itchy, tight, or flaky. Research shows that many postmenopausal women report skin dryness as a major concern. Menopause also makes the skin thinner and less elastic. Oil production drops, which weakens the skin's natural protective barrier. Sun exposure, hot showers, and harsh soaps can make things worse. This symptom is easy to overlook because people often blame the weather or aging. But if dry skin is becoming a regular problem, it's worth mentioning to your healthcare provider. Treatments may include hormone therapy or a skincare routine designed for menopausal skin. Sign number 6. Heart palpitations that can be scary. Feeling like your heart is racing, fluttering, or skipping a beat can be really frightening. These sensations, called heart palpitations, are surprisingly common during menopause. Research shows they affect up to 4 out of 10 postmenopausal women. Hormonal changes are usually the reason. Estrogen helps regulate the heart and blood vessels. When estrogen levels fluctuate or drop, your heart rate can become irregular. You might notice palpitations when you're resting, sitting quietly, or lying down at night. What makes this symptom especially stressful is the fear it creates. Many women immediately worry about heart disease. Most menopause-related palpitations are harmless, but they should never be ignored. If palpitations happen often, or if they come with dizziness, shortness of breath, or chest pain, get medical help right away. Your heart is not something to gamble with. Sign number 5. Periods that become more and more unpredictable. As you move into your late 40s and 50s, your monthly cycle may start doing some strange things. It might come earlier than expected, then skip a month, then last longer than usual. And no, this isn't random. For many women, this is actually one of the first signs that the body is heading toward menopause. During this stage, the ovaries begin to slow down and hormone levels start jumping up and down. Research has shown that noticeable changes in cycle length can begin years before your final period. At first, the changes are subtle. Your cycle might be a little shorter or longer. Over time, the pattern becomes more obvious. You may skip a period entirely, then have one, then skip several more. The flow can change too, becoming heavier, lighter, or just different than what you're used to. This symptom is easy to dismiss because many women expect periods to stay regular right up until they suddenly stop. But menopause usually doesn't work that way. It's a gradual transition that can take several years. If your period schedule feels off lately, start writing down the changes. That information can be very helpful for your doctor. Before I share the final 4 signs, including 2 that doctors rarely talk about, I want to ask you something. If this information is helping you, would you do me a quick favor? Tap the like button and leave a comment telling me which symptoms surprised you the most. Your engagement helps this video reach other women who really need this information. I read every comment, and I'm here to support you on this journey. Sign number 4. Bone loss that increases the risk of osteoporosis. This one is quiet but serious. During menopause, hormonal changes begin to affect your bones, often without any warning signs. Around this time, a hormone called FSH rises. Research shows that higher FSH levels can speed up bone loss. At the same time, estrogen, which normally protects your bones, drops. Over time, bones can become weak and fragile. This condition is called osteoporosis, and it greatly increases the risk of fractures, especially in the hips, spine, and wrists. The most dangerous part? You don't feel your bones getting weaker. Often, the first sign is a fracture, and by then, a lot of bone loss has already happened. That's why this is so important to track. A simple bone density test can catch changes early. Staying active with weight-bearing exercise, getting enough calcium, and making sure you have adequate vitamin D can make a big difference. Sign number 3. Digestive problems nobody talks about. This one truly surprised me. Digestive issues during menopause are incredibly common, but almost never discussed. A recent study found that nearly all women going through perimenopause or menopause reported some kind of digestive problem. We're talking about bloating, constipation, stomach pain, and acid reflux. For many women, these issues either started for the first time or got noticeably worse during the menopause transition. Despite how common this is, most women never receive a clear diagnosis, and many feel their concerns aren't taken seriously. So they try to manage symptoms on their own, changing diets, using supplements, and hoping for relief. Here's why this happens. Estrogen affects your entire digestive system. It helps regulate how fast food moves through your gut, supports healthy gut bacteria, and even affects how nutrients are absorbed. When estrogen drops, digestion can get completely out of balance. If you're dealing with new or worsening digestive problems during these years, don't brush them off. Talk to your doctor. These symptoms are real, they're common, and support is available. Sign number 2, joint and muscle pain that limits your movement. Those constant aches in your joints or tight muscles may not just be wear and tear. For many women, joint and muscle pain during menopause is directly linked to hormone changes. Studies show that more than 60% of women in midlife experience moderate to severe muscle or joint pain tied to shifting hormones. As estrogen levels drop, it throws other hormones, like cortisol, out of balance. This leads to more inflammation in the body and lowers your tolerance for pain. In simple terms, things hurt more than they used to. Your knees ache after climbing stairs. Your hands feel stiff after gardening. You wake up sore and tight. You might think, this must be arthritis. And sometimes it is, but menopause often makes existing joint problems worse. Estrogen normally helps keep inflammation under control. When it declines, inflammation increases, especially in joints and muscles. Poor sleep during menopause also plays a role, since your body repairs itself while you sleep. If pain is new or getting worse during this stage of life, don't ignore it. Talk to your healthcare provider. There are real options, from hormone therapy to targeted exercise and anti-inflammatory treatments. You don't have to just live with it. Sign number 1, urinary issues during menopause that disrupt daily life. This is the one most doctors don't bring up, but they should. Urinary issues during menopause are extremely common. Research shows that nearly 2 out of 3 postmenopausal women experience some form of urinary incontinence. The most common type is stress incontinence. That's leaking urine when you cough, sneeze, laugh, or exercise. And yes, it can be embarrassing. Here's why it happens. Estrogen helps keep the tissues of the bladder and urinary tract strong and elastic. When estrogen drops, those tissues become thinner, drier, and weaker. The bladder can also become more sensitive. You may notice burning when you pee, needing to go more often, sudden, urgent, I need to go right now feelings. What makes this symptom so upsetting is how much it affects daily life. Some women stop exercising. Others avoid social events. Many live in constant worry about accidents. But here's the good news. Help is available. Pelvic floor exercises, bladder training, medications, and sometimes hormone therapy can make a huge difference. What should you do next? If you recognized several symptoms on this list, don't panic, but don't ignore them either. Menopause is a natural transition, not an illness, but that doesn't mean you have to suffer through it. First, write everything down. Which symptoms you have, when they started, how severe they are, and how they affect your life. This information is incredibly helpful for doctors. Second, schedule a thorough medical evaluation. Don't brush things off as just aging. Effective treatments exist. Fourth, focus on lifestyle support. Regular movement helps joints, mood, and bones. A balanced diet supports energy and overall health. Managing stress improves sleep and mental clarity. Medicine has come a long way. Early fears about hormone therapy have been re-examined, and newer research shows that for many women, especially when started early, the benefits can outweigh the risks. You deserve to feel good. You deserve energy, clear thinking, and restful sleep. Please don't settle for suffering. Which of these signs surprised you the most? Have you noticed any of them? Leave a comment below. I read every one. If this video helped you, please like and subscribe. We create evidence-based health content for women navigating menopause. Share this video with your friends, sisters, and daughters. Understanding these signs can change lives. Remember, knowledge matters, but action matters more. Take care of yourself, my friend. You're worth it.